Salams and welcome to part number 3 of Let's End this Discrimination and the Stigma Against ADHD. So we look at a fabulous journal article, as we mentioned. We're going through this in the South African Journal of Psychiatry, open access article by Renata Skuman and T. Vogus. The title of the article is ADHD Stigma, the Silent Barrier to Care, and that's in the South African. I'll just keep it up for a while in case you want to read the details about that while I start the discussion already. So let's look at the literature review done by Skuman et al. The impact of ADHD on children and their families is very, very significant, especially if left untreated. A recent meta-analysis confirmed the negative impact of ADHD on the quality of life of children and adolescents. While their physical functioning was only moderately impaired, so I'll just keep that up a little longer. While their physical functioning was only moderately impaired, emotional, social, and school functioning was strongly impaired. A further meta-analysis confirmed that parents of children with ADHD experience moderate impairment in the quality of life when compared to parents with neurotypical children. Studies have confirmed that individuals with ADHD are at an increased risk of comorbid, that means associated other conditions, comorbid psychiatric disorders, including, that means with ADHD or autism spectrum disorder, you have other conditions also, including substance abuse disorders, smoking, drugs, alcohol, dacha, weed, cannabis, ecstasy, cocaine, methamphetamines, marijuana, or they say marijuana. I watched, some people have a beautiful pronunciation. They say marijuana. I say marijuana. Mary and Joanne. I like to call them as two beautiful girls, Mary and Joanne. Mary Joanna. When Mary and Joanne get together, it puts you on a hallucination drive. So marijuana, weed, dacha. So there's substance abuse, accidental injuries, educational underachievement, unemployment, gambling, teenage pregnancy, very big problem in South Africa. Teenage Mansa, please see my video on teenage pregnancy. Please, Gen Z, I'm talking to Gen Z and youth, don't destroy your life by unprotected sex. Please, 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 please. So difficulty socializing, delinquency, suicide, and premature death. So it's very, very serious side effects of this condition, and the parents are affected, and especially the mothers, because mothers are the primary caregivers. So I feel very, very sad, and I feel very compassionate for the mothers. Please remain strong. I know women medically and science, women are more strong than men, because the brain in a woman have got the corpus callosum, which is, I don't know where, I'm trying to keep my things near to me. The woman's corpus callosum, the bridge between the brain, this part of the woman's brain, you have the left hemisphere, the right hemisphere, and the corpus callosum in women is 33% times bigger than in men. And the reason for that is more intercommunication between the two sides of the brain. That gives women the ability to multitask. Men cannot multitask, so don't waste your time trying to tell a man to multitask. You're wasting your time. But a woman can multitask, so that's why she's a caregiver. But let's face it, women can also get tired, they can get drained out. So please, women, mothers especially, look after yourself when you're treating with children with disabilities or ADHD. Even the teachers, we feel compassion. I feel compassion for every female who are going through difficulties. So take care, look after yourself, please. So for both the children and the families, excuse me, these difficulties associated with ADHD are exacerbated by stigmatization. You don't need stigma in your life, please, man, sir. Stigma, since Goffman's seminal work in 1963, is now widely recognized as a global phenomenon that poses a substantial threat to individual and societal functioning. Stigma operates at both the macro and micro sociological levels by hindering individuals from access to much needed social support, exacerbating social anxiety, and hampering societal integration. Stigma is a complex, I just want to get a shine out of this thing. So we remind ourselves, we're talking about removal of stigma, and that's by sharing knowledge. Stigma is a complex social phenomenon that involves processes of labeling, stereotyping, separation, status loss, and discrimination. Pryor et al. Proposed a conceptual model of stigma. They refer to public stigma as being the consensual understanding that a social attribute is devalued as manifested in cognitive, affective, and behavioral reactions to someone they perceive to have a stigmatized condition. Self-stigma, please, Mansa, remember, women and mothers especially, when you're going through all these difficulties and trauma, you start stigmatizing within yourself because your child has got this problem. Then the community, the public, then starts pointing finger at the mother. But the mother is innocent, and they're blaming the mother, they're blaming the father, they say, that family, stay away from that family. So please, let's remove that type of self-stigma. So self-stigma is the apprehension of being exposed to stigmatization and the potential internalization of the negative beliefs and feelings associated with the stigmatized condition. Stigma by association. Mensa, stigma by association reflects social and psychological reactions to family and friends associated with a stigmatized person, as well as people's reactions to being associated with a stigmatized person. So please, Mensa, let's not point fingers at other people. We don't know when that condition can happen in our house. Please, let's be compassionate and caring to other people. Finally, structural stigma is the legitimization and perpetuation of a stigmatized status by society's institutions and ideological systems. Stigma seems to act as a barrier to care. Reported barriers to adequate mental health care and even medical care in South Africa include socio-economic hardship, lack of knowledge and insight, lack of family support, embedded cultural beliefs, very important, embedded cultural beliefs about mental health stigmatization. The embedded cultural beliefs are very, very strong in the Indian community, in the Black African community, the traditionals, as well as the Chinese community and some of the Afrikaner communities. Lack of healthcare resources and infrastructure and poor access to technology and information. So there's a lot of obstacles that we have. And we desperately need help from government, and we need help from big business. A lack of understanding of the causes of mental health disorders such as ADHD can cause a child's behavioral difficulties to be attributed to just acting up or believing that a child is behaving in a certain way owing to an insufficient parenting and discipline. Then the people start blaming the parents. They don't know how to raise a child. Then they start blaming the parenting. But they don't know that there's a medical problem. So let's not blame the parents. But yes, some parents, where the parents are a problem, we tell them, okay, there's a problem. But remember, is my philosophy, always remember this graph of mine. 90% of parents are good. 90% are good. Yes, 10% of parents are rotten apples and they got their own problems, so we feel sympathetic for them. But 90% of parents are good. And within this 90%, we have parents whose children got ADHD or mental disorders. So let's not say that these parents are rubbish. They are hardworking parents. They're trying their very best for the children. But let's not point fingers at them. Let's remove the stigma from our lives. Mensa, please, please, please. The way in which individuals conceptualize and understand mental health conditions influences the manner in which they access care. Certain cultural and belief systems may attribute psychiatric symptoms. This is very important. Sometimes they've got psychiatric problems. They say, you know what? This is bewitchment, is witchcraft, is sorcery, is magic, and the influence, the ancestors, Dari Mensalas Dwat, our ancestors are coming into our bedroom at night. And he said, there's a tokoloshi under the bed. So, and as described in a very nice article by, I want to pronounce it, Atin Danbila et al. In exploring community perceptions in the Limpopo province, Sihoana found that the Peri community's perception of mental illness is influenced by cultural and religious beliefs, which in turn affect the choice of treatment, such as seeking traditional or spiritual healing rather than mainstream Western psychiatric treatment. So this can be a major obstacle as well to care. However, stigma is not only a community response. Studies indicate in mental health care settings report the prevalence of discrimination by mental health care users ranging from 16 to 44%. Fox et al. Reported that self-stigma appears to be the most incapacitating part of stigma. Self-stigma negatively affects self-efficacy, self-esteem, and hope is associated with decreased empowerment, weakened social support, and diminished quality of life. The likelihood of these stigmatized individuals seeking mental health care, as well as the likelihood of adhering to pharmacotherapy, therefore decreases. Oxel et al. Found that being diagnosed and labeled with a mental health diagnosis carried a higher risk of suicidal ideation owing to perceived stigma, increasing secrecy and hopelessness. So we need to give hope to the people, Mensa, please. The people are suffering in silence. It is therefore crucial to understand stigma and the impact thereof on the diagnosis and management of ADHD. Addressing stigma has also been identified as a key element of the World Health Organization, the WHO. And let me quote, "A world in which mental health is valued, promoted, and protected, mental disorders are prevented, and persons affected by these disorders are able to exercise the full range of human rights and to access high quality, culturally appropriate health and social care in a timely way to promote recovery in order to attain the highest possible level of health care and participate fully in society and at work, free from stigmatization and discrimination." What a beautiful message. Stay well, look after yourself. Alhamdulillah.